Hi, everybody. Welcome to our webinar. Thank you so much for joining us today. I'm Angela, and I'm here with my counterpart, Fahad, who is going to be talking to you all today about this really awesome webinar that we're here to see today. And we are both with a company called Addit. Addit is an all-in-one dental software company that helps streamline operations, among other things, in a dental practice. And actually, Addit has been around for the last 10 years. And Fahad, weren't you like one of the first people that started working at Addit all those years ago?
Yeah, Angela. I was actually employee number six. It could be five or six, depending on who you talk to, but I'm going to stick with number six.
That's awesome. So, Fahad, why don't you background and what you do at Addit?
Yeah, of course. So I'm Fahad. I'm the VP of Demand Gen here at Addit, and my number one goal is to get Addit in front of as many people as possible. One of the things that we really strive for is to educate our offices, dentists, office managers on some of the basic understanding of how to run their office and how to run a successful dental office. So I'm really excited about today's webinar, and I'm really excited about how we can help your office essentially grow. I've been working with dental offices for nearly a decade. I've consulted with hundreds, if not thousands, of different managers and doctors throughout my dental career, and it's been fun. It's great. It's really, really amazing to kind of learn a little bit more about how each office operates, and everybody is different. And I love that. So that's what makes us really special, is we can really cater our product to how you run and operate your business. So again, super excited. And I'll pass it back to you, Angela.
Yeah, thank you so much for that, Fahad.
Yeah.
So again, hi everyone, I'm Angela. I'm the director of marketing here at Addit. I'm currently working remotely from the Ozark Mountains here in Northwest Arkansas. I've been at Addit for 2 years, so not as long as Fahad has, but in my entire marketing career, which spans about 10 years, this is just one of the best companies that I've ever worked for. I work really closely with the customer success teams and the product teams to understand the needs of our customers so that I can curate and contribute educational material for the dental industry. So I write all of the blogs and all of the ebooks and all the really great content that you can find on our website. I love the collaborative environment here at Addit, and it just feels like everyone in our company is just like on this mission to help make life easier for dental practices. And we see doctors here at Addit as like heroes of the world, and like we're trying to do everything we can to help them help the world. So thank you so much, Fahad, for having me. And I'm going to be moderating this webinar. So I'll just be Fahad's backup. And then at the end, we're going to facilitate some questions. But before we get started, we're going to have a little bit of housekeeping notes here first.
Good afternoon, everyone. So I'm going to share my screen just so that way we can kind of understand a little bit more about the webinar. Number one is, how do we boost treatment acceptance in your dental office? And, this is a really hot topic now because a lot of our offices, a lot of our doctors, a lot of our office managers and treatment coordinators, it's a problem that has been around for a very long time. And, a lot of offices, are not able to really kind of grasp the concept of increasing their acceptance rates. So, one of the biggest things that we really focus on is, how are we typically understanding what our patients know about dentistry, right? As dental professionals, we know dentistry, right? But a normal patient, they really don't know anything about like their dental hygiene. They really don't know anything about, what, the extraction looks like and what are we going to be doing and the root canal and all of those things. So, one of the biggest things, and I've experienced this personally, is, scaring your patients away with your pitch, right? It all starts off with that pitch. And as a dental office, we work very hard to bring patients in the door, right? And when we do that, we have an opportunity to help our patients. When we're coming in from a perspective of helping our patients, we understand that, dental hygiene is very important, and we figure out that there is a problem with their dental hygiene. There's a cavity, there is extreme pain or whatever the case may be. So when we're presenting, we really want to make sure we're presenting it to the point where we're not scaring our patients away. And today we'll talk a little bit more about that, right? So we have the tips and tools to get patients motivated to commit to treatment as soon as possible. And of course, give you and your team more confidence in conversations. I think that's going to be really important, especially as we go through our webinar today, because, when you're presenting something from a doctor's perspective, so if you're an office that you're the doctor and you present the treatment plan and you do everything, as doctors, they're very confident. We know, doctors have the confidence in understanding what they know. And obviously with dentistry, that's what they know. Then you have your treatment plan, your treatment coordinators, etc. So today we're going to really talk about that. Now, one of the biggest things is understanding some of the biggest challenges we're experiencing right now with treatment plans. So right now when we're looking at it, sometimes when we're booking the patients, kind of starts there, right? So understanding, hey, if I have a new patient or if a hygiene patient and we come in, scheduling the patients is going to be really critical, right? So when we're booking a lot of patients back to back or side by side or not allocating enough time, that that brings a lot of stress onto the doctor, onto the team to quickly present some sort of treatment. Because if the doctor or the treatment plan coordinator, or even like, a lot of offices have the manager presenting as well, if they're in a rush, the patients are definitely going to feel that too, right? So we're going to talk a little bit more about that today in our webinar. And of course, resources, right? When you're presenting, you really want to have everything in front of you, right? And you really want to understand patient fears, their concerns, their budget constraints, whatever the case may be. And those are some of the biggest obstacles that we're going to be facing, right? And building trust and with your patient, and then building trust with your team as well, right? So understanding how we can kind of create that environment to where patients trust us and your team members are also confident in presenting and helping them get that acceptance rate higher. Of course, tools, right? I think one of the biggest things with treatment planning is having the right tools around you to make your job easier, to make the decision from the patient side a lot easier as well. And here at Addit, we've actually come up with a really good way to level up your treatment plan conversations, right? And that's the theme of today's conversation and today's webinar is how do we level up your treatment plan conversations? So we'll talk a little bit more about that today, where we're going to listen. How do we listen? How do we educate? How do we have like really good visual aids and tools? In the poll earlier today, 100% of the people today are saying, hey, we have everything on paper. We have to print it out and we show it to them. So we'll definitely dive deeper into that today. Earn trust, right? If you have a patient, you have that rapport, they've been coming to your office for years. That's one type of trust. And of course, you have a lot of new patients. And when you're tracking your new patient production, a big part of that is earning trust whenever you meet with them for the first time. And of course, language. This I think is going to be really critical because again, giving experience from my perspective, and Angela, I know you have a couple of stories as well. It's language,
Oh,
using
yeah,
the right language.
definitely.
Using the right language is going to be very critical. Unbiased, right? We'll talk about that, and then of course payment options. So when when we're starting off, I think in any industry you're in, whether you're in medical or you're in the service industry, I think it's really important to understand what your patients want, what your you know customer wants. And I know using the word customers a little out, it's not really relevant. But at the end of the day, you want to make sure your patients don't feel like a number. You want to listen to them. And what I mean by that is, it's a conversation. It's not you telling them what to do. It's more of a conversation, right? And I feel like this is so overlooked, especially on in the dental side, because again, I've done implants. I've had implants done to me. I've had root canals done to me. I've had so many things done to me. And, believe it or not, I'm comfortable with my doctor, but when it comes to certain things like this, where you're coming in and you're, going extensively, going into my mouth and taking out stuff and all of that thing and all of that that's happening, you don't want to make it a one-way conversation. You want to make it a two-way conversation. Don't rush it. And when patients feel rushed, they don't buy, and that's a fact. And that's just not even in dental. That's in just consumer psychology, right? Allocate enough time so patients have those questions. And the biggest thing is when you're answering the questions, you don't want to answer without without giving them all the information. So allocate enough time for patients to ask. This kind of goes back to your scheduling, how you schedule your patients. If you know you have back-to-back patients, unfortunately, you're going to rush the conversation because you have someone else waiting for you. So it's again, it goes back to how you're scheduling your patients and allocating the right time. And then, understanding their oral goals, fears, worries, concerns, and, what do they want? Like, do they care about their smile? Do they care about their overall health? And chances are, because they're at your dental office and because they've gotten to the point where they're on the verge of accepting a treatment plan, they do to some extent care about their dental health. And it's our job, or the office's job, to understand that and cater the conversation to what they care about. What are their goals? What are their fears? What are their concerns and worries? All of that stuff. So again, really, really important to understand this. And we're going to show you a little bit more tips on how to do this, but listening is very, very critical. The second thing, of course, is, if you're a doctor and you're coming in for treatment planning and treatment conversations, educate. Educate is very, very important. And this is where I feel like when you're educating your patients, you have to understand what do they know, and making them feel like, okay, yeah, this is a conversation and this is a decision that I want to make. So visual tools are really good, right? As much as possible, showing them exactly what you're going to be doing. I think that is very, very important because, again, it's an extensive, procedure, whether it is a root canal, whether it's an extraction or planting an implant or whatever the case may be. Have something visual. And, one of the things that my doctor does, which helped me out a lot, was, having like a video, showing them a video of what we're going to be doing today. Now, obviously, you want to pick and choose what videos you guys use because there's some videos out there that are just so graphic they might even scare your patient away. But of course, it's just having a visual and giving a much clearer idea of what you're going to be doing to your patients. So this is where educating them becomes very, very critical, right? And I love this because a confused mind will never buy, right? A lot of people, again, this goes back to consumer psychology, right? It's the concept of, paralysis by analysis. If you are thinking too much, you're not going to move. If you're thinking too much and you're being thrown all this information, you're going to overthink it as a patient, and you're just going to be like, you know what, I don't think it's a good time. I don't want to do it, blah, blah, blah. And again, the last thing is emotion, right? Patients really, really, make decisions based off of emotion. And again, it goes back to consumer psychology. A lot of people make those decisions based off of emotion. Um, so we want to make sure we are kind of tapping into that as well. So educating is very, very important. The second thing is visual aids, right? So visual aids is really cool because we have all the technology in front of us, and what I mean by that is you know having like an X-ray, having it in front of them, giving them an example, right? Rather than using spreadsheets or printouts from Dentrix, etc., use like a customizable dental treatment plan software. What we mean by this is customizing it to exactly what you're going to be doing to them. So breaking it into phases, breaking it into different options, payment options. I think the number one concern or number one objection, office managers, treatment coordinators, and doctors get is payment, right? It's gonna be a lot. I don't think I can afford it, etc. But if you have a customizable dental treatment plan software, you can proactively address those objections during the visual aid, right? So just showing it to them. Again, printing out Google spreadsheets, etc., is good, but it does doesn't give them a more custom feel to what they're doing, right? Enable patients to sign, right, and look at their cell phone, get it in front of them, and let them touch and feel it. Make it easier to help them understand what they're doing. This also makes it easy for you to do post-op consult, and what I mean by that is, let's just say, for example, you presented and they didn't accept for whatever reason. Well, now that you have that, you have some sort of visual aid that you can refer to when you're following up with them to bring them back into the office. Hey, did you get a chance to review what we sent you in your email or whatever the case may be? And again, everybody's on their phone, right? Every single person's on their phone. Honestly, when I have paperwork from doctor's offices, I literally have the folder and I throw it in the backseat of my car and I never see it. And then tracking it down is also a pain. So when I'm ready to talk to my wife or my significant other about such a huge, change or such a huge decision, having that visual aid, I can just pull it up on my phone and go over everything, payment options, go over what we're going to be doing, having the chart in front of you, very, very important. And it's stuff like that that makes the patient comfortable. And again, these are certain things that are going to help you increase your treatment acceptance rates. And we'll talk a little bit more about this today as well, right? So we're going to dive deeper into that also. The second thing is earning trust, right? There's two types of patients. You have your existing patient, and then you have your new patient. And when you're reviewing your production numbers and you're reviewing analytics and metrics in your office, there are two types of production numbers that you're tracking, right? Your new patient numbers, and then of course your existing patient numbers, right? Your new patient numbers, you want to make sure, hey, if I have a brand new patient that came into the door, that's coming in for a cleaning or whatever the case may be, and, I found out that they have a cavity and they possibly need to have, some sort of work done to their mouth. You're presenting a brand new treatment to someone that you've never met and they've never met you. So again, earning your trust earning their trust so you're not sounding like a car salesman. So you're not sounding like a salesperson. You want to be confident in your delivery, not too pushy, right? And this is where, again, it goes all the way back to like time, right? You're allocating enough time. You explain who you are, what you do. You're coming into the conversation as a human and not, if you're a doctor presenting it, this doctor with all these accolades or whatever the case may be, but you're coming in, hey, this is who I am, my previous experiences, blah blah blah. Scare tactics, obviously, you want to focus on the benefits and not what's going to happen if they don't do it. Again, fear is not the best way to get your patients to accept your treatment plans. It's mostly, hey, this is what your life is going to be like when you do something like this, right? Tailor the plan to the individual's like needs, right? Um, this is something that we really tell our clients, especially when they're presenting, is you want to make sure that you're presenting it in a language that they understand, right? You want to be thorough in your analysis, but mainly recommend treatments that are obviously best interest for them. And this goes into the language, right? So language is key. I gave you guys an example, Angela. I think we were talking about this earlier today about, I think you took like your kid to like the pediatrician, and what happened?
Yeah, no, I mean, so like you're so right, Fahad. Like listening is also part of this as well. So you're listening to your patient's concerns and then tailoring that treatment plan presentation to fit those needs. So if, like, for example, I've got like a high school reunion coming up and I'm wanting some teeth whitening, and so my dentist will say, you know what, we can get this done just in time for your high school reunion. That's part of like tailoring that experience. And then language is so important because my daughter and I went to see her pediatric dentist, and she has a new tooth coming in, and her dentist had mentioned that there's an eruption in her mouth, and my brain just went to like a volcano erupting out of my dog. Like, I don't know why I thought that, but I just my like using that term eruption is not necessarily a layman's term. We see this a lot with our clients where they think that they're using a really common terminology for specific procedures or to describe certain things that are happening in a patient's mouth. And that doesn't always translate, right? It's almost like you're speaking a different
Absolutely.
language. So terminology is key for sure.
Yeah, yeah. And I recently had one of the most excruciating, tooth pains I've experienced, right? And thankfully my dentist was available. So I booked like an emergency appointment. We came in. And again, this is how I first met my doctor, through an emergency appointment, because nobody was available. My actual dentist was just not available. So I was like, okay, you know what? This is just a really, really bad experience. I can't keep going along with this. So I just booked an appointment with the next person that was available and that was able to see me. Thankfully, he was pretty close by. I do it now. When I went in for the extraction, I mean, we're talking, you know, immediate, okay, yeah, we gotta go in, we gotta take it out, all this stuff. And I just felt like everything around me was just like fast forwarding, right? And I'm like, okay, what's going on? What's happening? And then people are coming in and out, coming in and out. And there's like three different people that are talking, but yeah, we're gonna do this. Okay, cool. Yeah, we're gonna do this. Okay, cool. And I'm just like, what's happening? It's happening so fast. And obviously, I was in pain, but the after the extraction was done, I had to come back for I think it was like a bone graft, or repairing it, um, post 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 extraction, because they were prepping my mouth, or that gap, for an implant. And then again, I was just upfront. I was like, "Look, doctor, I need to know what's going on, right? If we're doing a bone graft or whatever it is, I just need to understand what's going on." So, thankfully, he did take the time out. He was okay. You know what? I'm sorry. And then he went in and kind of, took the time to educate me, took the time to really talk a little bit more about what I'm doing, what is going on, what happened, and then really understood the type of language. And going back to what you were saying, Angela, a lot of doctors, office managers, treatment coordinators, we're so used to like dental terminology because it's literally our language. It spills into conversations with our patients, and our patients don't know any of this stuff, right? I didn't know any of this stuff. Came to know about it because I'm in the dental industry, right? But your normal patient doesn't know any of the conversations, anything. Yeah, we're gonna take tooth number 7 out and we're gonna put in this. And I'm like, whoa, 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 tooth number 7, what is that? Right? So it's just, again, like using the right language, simple, consistent is key, right?
Right.
Technical terms never work because, a lot of patients get intimidated when you throw these big words at them. And then, you're gonna stop and say, Does that make sense?" They're not gonna be like, "No, I don't know what you're talking about." Yeah, 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 it does make sense. Yeah, I know exactly what you're talking about. But in reality, they have no idea what you're talking about. So I think it's the responsibility is on us as dental professionals to really use the right language when it comes to presenting treatment plan, and when it comes to like understanding what their needs are.
And
What are
everyone
your thoughts, Angela?
using yeah, and everyone using the same terminology. So if you're going to use eruption, for example, the hygienist needs to use that term and the dentist needs to use that term. If your hygienist is saying, a tooth coming in and the dentist is saying eruption, then your patient might think that those are two different things. And so consistency also has to do with you as a team selecting the types of terminology that you want to use with your patient conversations, and then across the board everyone's using that same phrasing. And when you do need to use a technical term, because there's some procedures that absolutely need that, but clearly defining what that means throughout the process so that there's no confusion. And that's what the consistency means. It's that everybody on your team is on the same page and not using different terms to describe the exact same thing to your patient.
Exactly, exactly. Yeah, and it to me, in my opinion, whenever you're looking at it from like a patient's perspective, it goes back to what we were talking about, just making them feel comfortable, making them feel like, they you are recommending what's best for them, right? And that kind of goes into like our next topic, which is, check your judgment at the door, like being as unbiased as possible. At the end of the day, the decision is on the patient, right? And it's our job as either a treatment coordinating or a doctor is to come in with, hey, as much information, as much, unbiased information as possible. So, like, person's background, person's gender, person's appearance, ethnicity, culture, all of these things, you want to take into consideration and making sure that you're coming in with an unbiased opinion, right? If someone is the same culture as me, someone is the same background as me, do I want to make sure I'm doing what's better for them or what's best for them? It's stuff like that really does make a difference, and especially when you're looking at it from the patient perspective. If you have a patient that's a woman and you're a male doctor, you want to make sure you are catering your unbiased whenever you're presenting that based off of who's in front of you. So these are certain things that we definitely want to make sure of, and we want to make sure we're pretty consistent in how we talk to our patients, and just making sure that it's as unbiased as possible. Now, the biggest thing is payment options. So remember we talked about, we have on our platform, about 1,500 to 2,000 dental offices that are on our platform. And when we came out with our treatment planning software, the biggest thing that every single person told us was, I need to overcome the objection, the hurdle of price. I think when you're presenting treatment planning, that's the number one objection that our offices and most offices typically get. And when you're creating a customized treatment plan, I think it's very important to give your patients options when building out payment options when you're building out that plan. And the good news is Addit software does exactly that, right? So payment options helps boost same day acceptance. If you know the number one objection is going to be price and payments, proactively overcome that, right? Offer multiple payment options: credit card, care credit, full amount now, pay off over time. You can have flexible financing options, in-house payment plans. Look, if if you're scared of doing care credit and pulling up your credit or whatever, look, if you have you know payment plans, we have our in-house payment plan, no credit check, but this is what we can do. We can offer online payments, you can pay through the patient portal, etc. So again, it's just giving them that fully custom option when it comes to the number one objection, which is price, which is payments. When you're scheduling procedures, um, in one day or a few visits as possible, break it down into phases, break it down to visits, pre-schedule your visits, and make sure you get priority days and times that works best for your patient's schedule and budget. So when you're trying to make sure that your acceptance rate goes up, I think it's very important to understand, what is my number one obstacle? What is my number one objection? And we all know that our number one objection is going to be this. And as a dental office, I shouldn't shy away from this. At the end of the day, you are providing a service to help your patients. And if you've done a really good job of presenting, if you've done a really good job of using the right language, if you've done a really good job of building that rapport, earning trust, all of those things, then in the patient's mind, the patient is pretty much convinced to do this. They want to do this. Look, doctor, I want to do this, but it's just so much money. That if you're getting that objection, then you're successful, because it's not like, I don't really believe in it. No, I don't really need it. No, it's okay. Those objections, unfortunately, it's really hard to overcome. But if your objection is price, this is where you have full control. Hey, look, talk to me a little bit more about the price. What is your biggest hesitation? And this is where you can kind of create your custom payment plans and custom payment options when you're doing your presentation, when you're presenting that.
And
Now
Fahad,
we're gonna yeah,
I'd like to add one more thing before we move on with that.
yeah.
So this is also a really great time to bring in the patient goals. A lot of patients do have goals with their dental care, and I'll go back to like my earlier example of needing like whitening done before a high school reunion. If that high school reunion is like this weekend or coming up really quickly, that's also a really great motivator on top of offering a lot of payment options. And that goes back to like speaking to your patient beforehand and bringing that back in to create a sense of urgency without actually like being pushy. So you can say like, I know you said that you wanted to get this whitening done before the reunion and that it's this weekend. This would be a really great time to start this payment plan. You can get it done before the reunion and then pay it off, in $15-$20 increments over the next 12 months or whatever it is, right? And that makes it a lot more palatable for a patient, and you're also reminding them of the whole reason why they're there. So that would be a really great way to tie in the payment conversation with aligning with the patient goals.
No, I love that. That's really, really good. And I think, and that's again bringing back the motivator. And I love that, Angela. Thank you so much for that. Um, so let's kind of take another poll, right? So again, remember I said this was going to be an interactive webinar. We love to get feedback. We love to do, have like try to have open conversations and stuff like that. So the next question on the poll section is, how do you track your treatment acceptance in your practice? So we'll give you guys a couple of minutes, about 30, 35 seconds or so, to kind of give us as many answers as possible. And I could refresh this to see where we're at right now.
This would also be
Um,
a really great time to add any questions to our Q&A
yeah,
section too. So
yeah. So
if
Q and
you
A.
have any questions that we haven't answered so far, let us know. Fahad, I'll keep an eye out for the Q&A and section and let you know when we've got some questions coming in too.
Yeah, yeah, absolutely. That sounds like a plan. Yeah. So again, just kind of going back to housekeeping, Q&A section is right here. Taking the poll to get access to it is right here. And then of course, let's give myself a little round of applause. These are like just emojis. And Angela, thank you
I'll
so
give you
much
some
for,
too.
yeah, there you
There
go.
you go.
Love it. Um, cool. So again, just going into the poll, you can answer that. The question again is, how do you track treatment acceptance in your practice? We have a couple of people that are, right now we have in the practice management system. So I just look at it through Dentrix. I look at it through, Open Dental, etc. Um, Spreadsheets. That's the second one, or I have an analytics software or something else. So those are the four options. If you can, just go into the polls and answer that, and then we can kind of talk a little bit more about how does Addit help with what we just talked about. So using the level up strategy, how does our system and our software create custom treatment plans to help help your patients accept treatments and help you boost your treatment acceptance? So we'll spend the next 10 to 15 minutes, maybe even less than that, talking about that, and then we'll kind of open it up for Q&A and stuff. So it looks like, a lot of people, a lot of us are, tracking in our Dentrix and our practice management system. So this is an interesting question. And I like asking this because, when it comes to data, I think making decisions based off of good data is so critical, right? And what I mean by that is, if you don't know, if you don't have good data that's telling you what your problems are, you'll never really know what your real problems are. So like when it comes to like your treatment acceptance and treatment, presentation metrics, it's very important to understand what those numbers are, because then what you're able to do is you can create strategy and you can create custom, plans around your patient, specifically your patient treatment planning processes. So what we mean by that is, here at Addit, we have an entire treatment plan software that kind of talks about and brings back what we talked about, the level up um, ideology that we kind of created with our clients. We do that and we implement that within our treatment plan software. So what we mean by it is, we're able to help you create a custom plan, right, based off of the patient. So if we're looking at, an example, we'll do like a testing treatment plan. So we can do testing, And this is where we can kind of bring in, again, we sync with your Dentrix, your Open Dental, etc. And this is where we can actually bring in everything into your custom treatment planning. So when we talk about level up, we have visual aids. This is where we can show them everything. So you can show benefits, you can show the tooth columns, you can show the tooth diagram, right? You can toggle between all of these things, their insurance payout, show estimate stamp, right? So, like, let's just say, for example, I want to add a procedure. So we are able to add it based off of planned and unplanned, right? So if you have an extraction that's planned, you can add that into your custom treatment planning. And when you're building this out, you have, again, you can add phases, you can just put it in one. And overcoming the price conversation and overcoming the conversation of, man, I don't know if I can afford it, whatever the case may be, we're able to help you do that in your presentation. So with our custom treatment planning software, we can show them, hey, how much insurance is going to be covered based off of the insurance that's in their system. This is where we can apply specific discounts, right? Hey, we understand that this is very important for you. We actually are able to help you with certain discounts. We can do a one time payment, we can apply the discount, and then we can add very custom payment options whenever you're presenting those treatment plans. So let's just say, again, for example, you want to do a monthly payment plan and, they're paying $50 today. And then you want to do the rest of the payments over the course of 2 months. So now it breaks it down for you automatically. So essentially, what Addit is able to do is integrate your payments into your treatment plan software. So now you're again able to bring everything into one place. Your consent. So again, we can digitize all your consent and you can attach, your specific consent forms as well, right? So you can attach that here. And this is where you'll be able to, again, present to them their different options of payment. So again, going back to like understanding our number one objection is going to be pricing. So this is where you can come in and show them different payment options and different payment installments, etc. So again, making it very, very easy and very comfortable for your patients to make that decision. You can have a card on file, and that card on file is going to be billed on those monthly frequencies, whether it's monthly, weekly, or whatever the case may be. And because the card is on file, it'll automatically deduct that payment. So as an office, you can kind of be, confident that you're going to get paid because you are, creating a very flexible option. And because they have a card on file, then you as an office knows that you're going to be able to collect on that payment plan. So a lot of times, a lot of offices have to do this manually. Okay, you know what? I'll give you a custom payment plan, but I just want to make sure when I call you, you have the card ready. Just make it as easy as possible. We can auto deduct it for the patients. And again, they can sign and date and we can click submit. So this is where you build it out. And of course, you can actually see the preview. So when you click on the preview, this is where you can have that visual aid right in front of them. You can text it to them, you can email it to them, right? So it's all in one place. And it's super convenient. So they can see everything. And as you're presenting it to them, it's all visually right in front of them. Right, you can download the PDF, they can download that, etc. And this is where they can see a breakdown of everything, their payment options. They can choose the payment method. Everything is pre-filled. They sign, and then of course the doctor's signature. They click submit. Everything will be properly recorded, and you get a copy of that. So just really understanding how to help you boost your production and help boost your treatment. This is one of the steps that Addit helps whenever you're presenting your treatment plan with our new treatment planning software. Again, building it custom, giving them exactly what you are presenting to them, giving them really good options when it comes to payments. So overcoming that number one objection when you know that's going to be their number one objection. And then having really good visual aids to level up your treatment planning processes. And the last question that we asked is, how do we know this is working? Well, you can do that by tracking your treatment acceptance, by tracking your overall, acceptance rates. And I think right now, based on the poll, there was a few people that said, "Hey, look, I track it. I track everything in my Dentrix system." So here at Addit, what we do is we have our analytics system that tracks it for you, so you can kind of see it on a daily, weekly, monthly basis. So if you look at your practice performance, it will show you everything in front of you. So you can look at, not only your overall production and your visits, but you can look at your restorative elective cases and what is your diagnostic rates and what are your acceptance rates. So when you click on that report, again, it will show if you are seeing an increase in your acceptance rates. It will show which patients have paid. It will show a lot of different cool things. And again, having the right data is going to help you astronomically whenever you're implementing these types of strategies. Because if you have good data that shows you, small inefficiencies that are happening in your office, you can then implement good plans and strategies like having better visual aids, like having a better payment option, like having everything presented to them right in front of them. So now that's going to help increase your overall acceptance rate and get you to your goal, which is 80%, 85%, et cetera. So again, data is really important, but it's also having the tools necessary to implement and help increase that acceptance rate. So yeah, so one of the things that we're doing for the attendees of our webinar today is, we have a bunch of really cool resources, and we want you guys to take advantage of that. So one of the things that Angela has done a really good job is two different resources that we're going to be giving you. Number one is we have a free guide of, understanding the power of treatment plan software. That gives you kind of like a step-by-step process. It's an amazing resource. So that way you and your team can kind of read on it, look at it, and kind of educate yourself a little bit more. The second resource is take a tour. What we just showed you, what I showed you within the Addit platform, you don't really have to, book a demo or try to see it. You can just do it yourself. So we have a tour that we're going to send everybody. In that tour, it's about 60 to 90 seconds, and it's going to show you how you can use Addit software to build out a custom treatment plan, better visual aids, better payment options, and help you increase your overall acceptance rates. It's a 60-second tour. You click the buttons, you watch and feel and experience it yourself. And of course, at the end, we'll send you a Starbucks gift card as a thank you for your time. And of course, as a thank you for attending today's webinar. And again, treatment planning is very, very important. It's a critical part of your office because it feeds into the most important metric, which is your production, right? So if we're able to help you increase that, then we're able to help increase your overall production for your office. So we'll, kind of, Angela, would love to get some feedback from you. I know I kind of took over, but anything on your end?
No, I know one of the questions that we typically get when we're talking about treatment plan software
Yeah.
and making payments is like, what happens to those payments? Do they post to the ledger? Do they is it really synced with my, with my EHR, my PMS? And that answer is yes. In Addit, we do automatically post payments to the ledger. That's one of the many features that you can get in Addit that really cuts down that manual all those manual tasks that you're usually having to perform. So when a patient accepts their treatment plan and makes a payment, all of that is automatically synced with your PMS. So that's one of the really cool features that's really hard to find on a lot of other all-in-one platforms. And that's just a common question that we typically get when we talk about treatment plans. So I
Yeah,
wanted to talk about
absolutely.
that.
Angela, amazing. Thank you so much for that. Yeah, and just to give you guys a little bit of background of Addit, just like I said earlier, we've been in the dental industry for nearly a decade, and we started off, just as a simple website company for dental offices, and as we grew organically, a lot of our doctors needed help with a ton of different things, and our CEO went back to the drawing board and started developing those like that software that helps address questions like I need help with scheduling, I need help with reminders, I need help with treatment planning, I need better numbers and all of those things. So we built out our platform, and now we're an all-in-one very robust system that not only does treatment planning software, but we have 20 plus tools that really helps kind of manage your office. You know, a lot of dental offices, we say this in a lot of our webinars and a lot of our CE courses is, everybody is experiencing subscription fatigue. And what we mean by that is, outside of your Dentrix or Open Dental system, a lot of offices use a variation of like two to three, sometimes four softwares to schedule, remind, call, analytics, payments and reviews and all of those things. Where here at Addit, we have everything in one place and we add so much more, like we saw today with our treatment planning. So again, I would highly, highly advise everybody to download the free guide, but I would definitely advise everyone to take the tour. It's a self-guided tour. You take it, it's 60 seconds, and at the end, for your time, we do give you a Starbucks gift card, and you can enjoy a cup of coffee on us. But it just gives you a much better idea of what we have to offer, and when it comes to boosting your treatment acceptance rates. But yeah, Angela and I, thank everyone for coming in. We really, really do appreciate your time. I know taking out about 45 minutes in the middle of your day is a lot. So the fact that you're able to give us that type of time just means a lot to Angela and I. And, we'll stay open for a couple of minutes. Love to get some questions. Again, just going back to the housekeeping, this is where you can ask a question. Don't hesitate. We welcome questions, whether it's, or even feedback. Those are all really good. It makes us better and good and just gets us to a better place as well. So yeah, so we'll open it up for maybe about a minute or two to see if anybody has questions. If not, we'll probably start closing it out. Again, thank you so much, everyone. Angela, any closing statement remarks on your side?
Just thank everybody for attending our webinar today. I know that your time is really, really valuable, and we value your time. So appreciate that. If you have any questions about the tour or anything we discussed today, feel free to reach out to us, and we'd be happy to answer any of your questions after the webinar. Our tour is actually really new in the industry. A lot of software companies are just trying to get you to like book a demo to talk to them, and that's fine. But we found that sometimes you just want to try it out, or sometimes you want to like get a feel for what a software is before you even book a demo. And so that's why we created the tour. Like it's no salespeople or trials that you have to sign up for. You just click on the link that we'll send you, and it'll just walk you through the tour. And then at the end, just let us know where we should send your Starbucks gift card, and that's that. So again, thank you guys so much for attending, and you'll be hearing from us in a couple of hours with all of those resources.
Thank you again, Angela. Everyone have a wonderful day. Enjoy the rest of your week. And we look forward to seeing you again in our next webinar. Take care.